And welcome to Nutrition Science Bites. This week, I'm talking to Kelly Lambert, who's a dietitian who has spent almost 3 decades and most of that time specializing in kidney health. So, welcome, Kelly. I just want to let everybody know about your title because I think you're the perfect person to chat to today because you're the co-director of the Kidney Lifestyle Research Group and Deputy Director of the Health Innovations Research Centre at the University of Wollongong. So, thanks for coming on Nutrition Science Bites to chat to me today.
Thank you so much, Claire. My favourite topic. Happy to do it anytime.
And I should have said Dr. Kelly Lambert. Was your PhD in kidney disease?
It was indeed on cognitive impairment and health literacy in people with kidney failure and how that impacts dietary adherence. It was a fabulous topic.
So
Yeah.
I guess that just really absolutely cements your expertise in this area of kidney health. But do you know why I wanted to talk to you? I've actually noticed that people are talking about kidney disease more, sort of like out in the community, but also I've also noticed that the bigger societies who might have a different chronic disease, they're also talking more about kidney disease. And I wanted to pick your brain, like, is kidney disease actually becoming more prevalent?
It is, and it's partly driven by the fact that diabetes, hypertension or high blood pressure and obesity are also increasing, and they're all the key things that cause kidney disease. So with increases in those, you will get increases in kidney disease. And it affects roughly 10% of the Australian adult population. So you're bound to have a patient with kidney disease if you have someone with diabetes or cardiovascular disease or who are obese. It's just going to be there.
Yeah, and you know what that tells me then, Kelly? That's actually why I think people are talking about it more because that
Yep,
means if it's 1 in 10, that
yep,
means then that you're bound to know someone, a relative,
yep,
a friend, a close family member. So
yep.
I think that's probably positive then that people are talking about kidney disease more. So
Oh, no. Yeah, not enough, we think.
not enough. Okay,
Yeah,
so can you tell us then, because now that, there's probably lots of other people going, actually, now that you mention it, everyone's
yeah.
talking about kidney disease. What is kidney disease?
So when we're talking about kidney disease, we're referring to chronic kidney disease, and that's a condition where you have a change in the structure or function of your kidneys that lasts for more than 3 months. That's the important thing,
Right.
because sometimes there are conditions where you'll have a temporary, you know, poor, decline in your kidney function, but you may get resolution. It's more important that we talk about chronic kidney disease because that's the irreversible condition that we really want people to focus on.
Okay, so you said chronic kidney disease is if that kidney function is not really great for 3 months or more. Well, how is
Yep.
someone going to know that? So
Well,
how do
yeah.
you find out if your kidneys aren't working as good as they could be for,
Yeah,
for
it's
three
easy.
months? Yeah. Oh, it's easy. Right.
It is easy. It's a combination of you need a blood test, and it's the most common blood test taken in people,
Wow.
and that's a electrolytes, urea, and creatinine test. It's an easy blood test, but it's really beneficial to have a urine test at the same time, and that's
Right.
because by having the blood and the urine, what we're looking for in the urine is protein, and if it's there, that's a problem. And if it's there, that also tells you how quickly your kidney function may decline. And that is a real risk. And we would be far more aggressive with the treatment if we had protein in the urine than if it
Okay.
wasn't there. Yeah.
Now, I'm going to ask for some more information, please, because I'm thinking that's a lot of
Yes.
information you've just given. So, first up, you said protein in your urine's a big deal. Well, how does protein get in your
Yep.
urine? And what's that got to do with your kidneys?
Yeah, so your kidneys are little filters, and they literally have millions and millions of little filters in the kidney. And some genetic conditions can cause extra filter, like extra holes to be in that filter.
All
And
right.
other conditions like diabetes or obesity or high blood pressure can cause those little filters, excuse me, to become damaged over time. And either the change in the structure of the filter or the damage to the filter means that protein doesn't get reabsorbed in the way that it should, and it'll just leak through into your urine as a result. So it can be damaged in two ways.
So would I be right then, Kelly, in saying that, if you think about it, it's kind of like if your kidneys are like, little sieves or little colanders,
Yep.
they're normally stopping these big molecules
Yep.
and a protein molecule's pretty big. So it normally can't get through the
Yep.
holes. But if the holes are damaged, then the
Yep.
protein gets through. Now, That sounds to me like that's pretty bad because everyone knows that you need protein to stay healthy and protect your
Yeah,
muscles and a whole range of functions. So you're saying this is one of the really big signs that all your kidneys are
it is.
really, really under pressure.
Yeah, it is. And this is part of the issue is that when GPs do a test for kidney function, they often forget this extra bit, which is to do the urine as well. And that really is the critical part that tells us how aggressive we should be with treatment and what's your likelihood that it's going to be a problem and you might end up on dialysis, for example. We do need to quantify the amount of protein that's coming through and do it regularly. Yeah.
So it sounds like to me there's one message for the listeners, like if you
Yeah.
have kidney disease yourself, then finding out about this aspect of protein, which is the albumin coming through in your
Yep.
kidneys. That kind of
Yep.
makes sense, that analogy then about, holes in the sieve, because,
Yep.
like if your sieve's got lots and lots of holes, you can get those plastic ones. Well, they
Mm-hmm.
actually don't work and it's time to get a
Yep.
new one. So now I'm thinking, wow, if I've got kidney disease, I really want to know about that protein aspect.
Yep.
So then
Yep.
the other thing you said, though, you said a whole bunch of things that are in the blood test. So what were those things again that they're looking at in the blood
Um,
test, and what do
so
they mean?
Yeah, so the real thing that we're looking at is your estimated glomerular filtration rate, and your glomerulus is the filter.
Right.
So we can measure it precisely with an isotope, but we tend to do it just as an estimate. And basically, the way we do that is we look at a molecule called creatinine in your blood, and what we do is we figure out how much creatinine is in there. It gets put into an equation, and that gives you an estimate of your kidney function. And a good way to think about it, and this is what I would really encourage people if you have had a kidney function test, ask the doctor what that number is, because it's roughly equivalent to a percentage. So it's reported as a number. So if your GP said to you your eGFR was 69, that's roughly equivalent to about 70% kidney function. And so
Okay.
what we want to do is monitor that number over time, and that the way that number moves around is really important. Yeah.
So there's some abbreviations to look at. And you know what? I encourage people, you can check if you've ticked the box for your results to go to My Health Record, you can go and have a look at them online. So
Yeah.
EGFR means estimated
Yes.
glomerular filtration rate. So that's not now about the
Correct.
holes. That's just about the overall rate at which your kidney is functioning. 100% would be perfect, no kidney disease. And then the percentage
Yeah.
is roughly related to that. And you said it has to
Correct.
be
And it's
estimated.
measuring.
Yeah,
Yeah. Sorry, I was going to say it's measuring it the mils being filtered per minute.
right.
So that's telling you roughly it's that little kidney or those kidneys are filtering roughly 69 mils per minute or thereabouts. And being able to filter more blood is an excellent thing. But if your kidneys are filtering 5 mils per minute, then it's really barely struggling to do a job. Yeah.
Okay, so now here's the test if I've got it right. So if your eGFR is 5, it means you're only filtering 5 mils of blood per minute instead of the
Yeah.
100 that would have been ideal.
Yeah, that's right. Yeah.
That's not
And then
much. 5 mils a minute, that's a teaspoon. Oh dear.
no, it's not much. And, if you were literally, if that was your blood test result, you would be in front of a doctor a long time before it got to that, because you wouldn't feel very well and there'd be signs and symptoms that would be a particular problem.
Right.
Um,
Okay.
yeah.
Yeah.
Yeah. So, for the most part, when we look at your eGFR, what then happens is that we would categorize it into one of 5 stages, with
Right.
stage 1 being early kidney disease
Yeah.
and stage 5 being kidney failure, or, end stage kidney failure. And that's where your kidneys aren't working sufficient for us to keep you alive, basically. And that's where 5 would fit into.
So at what stage, because again, if people know lots of people with kidney disease, they probably know
Mm.
people who are waiting for a kidney transplant or who are on dialysis. Is that 5 at that stage?
Um, Potentially, although you could. The problem with kidney disease, particularly chronic kidney disease, it's largely asymptomatic. So you don't even know you're necessarily sick until you could have lost 90% of your kidney function.
Wow.
And the symptoms are largely can be written off to something else. So you might feel lethargic and fatigued and have some nausea and just have gone off your food, and maybe your weight has changed. People can write those off to other things. But when it
Yeah.
gets down to 15% function or less, you really are terribly sick. You would have fluid accumulation. You would be feeling generally very poorly, and you would have come to a doctor a long way before that. And generally, in my experience, it's been people who have around 30% kidney function or less. That's when they're starting to say, something's not right. I better go see a doctor. There's a problem.
Well, you know what that
Yeah,
tells me, Kelly? That's just a reminder to people. If you go, I do not feel right, don't just put it down to, oh, I'm working too hard. Go and
correct.
have a chat to your doctor. I mean, sometimes I think we just forget to
Yep.
prioritize our health. Now, I've got another
Yep.
question along that, because you said EGFR, but you said there was a couple other things in the blood test that
Oh,
the doctor
yes,
is
yes.
looking for as signs of kidney function.
Well, what we also look at in that same panel is we would have a look at your potassium level, and then there's some other blood tests that we would take separate to that. So we might look at your magnesium, your phosphorus, we might take your vitamin D level, we might look at your hemoglobin. So these are additional tests that are done on top of that to see if there's side effects from the kidney problem. They're
Right,
not
that makes
intrinsic to
sense.
the diagnosis. They're just things that will go wrong if you've got kidney problems. Yeah.
Right. Yeah. Well, there you go. That's another plug for the doctor then. So I wanted to
Yep.
ask you, you said the risk factors, include things like having diabetes, having high blood pressure, and then also carrying excess body weight. Why does that increase increase the risk of having kidney disease? So maybe
Mm,
can we start with high blood pressure? Like what?
sure.
Because
Yep.
I don't think people would like a lot of people don't know they have high blood pressure either. So why does high
Yep.
blood pressure put more pressure on your kidneys so that you're more likely to get chronic kidney disease?
Yeah, yeah. Again, it goes back to these beautiful little filters. They're amazing objects. And when you've got high blood pressure, what that's representing is that the little blood vessel that goes into that filter is letting lots of blood in, but the vessel that goes out of that filter is very narrow, and hence the blood pressure is actually building up within that little capsule of the filter. And then
Right.
that causes scarring and damage to the kidneys. And so it literally burns out those filters.
Okay.
It's amazing anatomically. Yeah.
That makes sense to me. And I was trying to think of how can you visualize that? So to me,
Yeah.
that's kind of then like rather than watering the garden with the garden hose, you attach the nozzle like the fire people's
Yep. Yep.
hydrant, and you're trying to
Yep.
get that through your nozzle. Like, I mean, that could just blow out, your
Yep.
home garden nozzle, couldn't it? So
Yep.
that really is
Yep.
going to do a lot of
It's
damage
a
to
damage.
people's kidneys.
And the
So
problem is if that's uncontrolled for many years, that also will accelerate the process of having protein come through into the urine. So we want to control blood pressure as best as we can, as tightly as we can, to stop the damage to the filters, because they can't regenerate. Once they've damaged, they're damaged.
yeah.
Yeah.
So Kelly, we did another podcast previously on high blood pressure, and it's
Hmm.
really surprising. It's something like 1/3 of Australians have
Yeah.
high blood pressure, and of those, it's somewhere between a third and a half. It's actually not under control, even if they know
No.
that they've got it. So that's another one
Yep.
of those silent things. So when you're going to your doctor to talk
Yep.
about your kidneys,
Totally.
talk about your blood
Yep.
pressure. Well, your doctor will check that in anyway.
Yep.
So then you said both diabetes and
Yep.
carrying excess body weight also,
Hmm.
how do they put pressure on your kidneys?
Different mechanisms again. So when you've got a large body, you actually have to filter more blood. And again, if you've got that over a long period of time, it just burns out those filters in the kidney. They have to
Okay.
literally filter more blood, and therefore that just puts a lot of effort and stress in the kidney. Diabetes is a different thing altogether. So the issue there is that if you have diabetes and it's well controlled, fine. It's not going to be necessarily a major problem for the development of kidney disease. It's a risk, but it's when it's uncontrolled diabetes that's the problem. And it comes back to those filters where glucose is a very big molecule, and when it circulates in your blood and gets to the kidneys, it can leak through and cause damage and accelerate the scarring within that filter of the kidney. And that's the problem. It causes lots of scarring and damage, and therefore the filters are damaged permanently. So when you have better control of your blood sugars, you have less likelihood of damaging the filters.
Yeah, wow. There's
It's
so much to
amazing.
think about, isn't there?
Mm,
That's just so important then. And if people are early on in the diagnosis, checking all
Yep.
of those other factors to see what ones potentially
Yep.
are able to be managed. So
Mm.
the other thing that I heard in this, like, wow, there's more talk about kidney disease, and I heard some people saying, oh, and the guidelines have changed. You can't eat this, you can't eat that.
Yes.
So what's happened? Because sometimes when guidelines do change, not everybody gets to find out about it. So what are the
Yep.
nutrition guidelines for kidney disease broadly, and then which ones are now different to what they used to
Yeah.
be?
Look, it's such an exciting time to be somebody that works in the kidney disease space, not just because the dietary guideline part has changed, but also because for the first time in 25 years, we actually now have new pharmaceutical treatments that will totally change the disease course. It's
Wow.
unethical for people not to be on these particular medications. So that's gone on hand in hand literally in the last 5 years. And that's the exciting part for me. So if I go back to your question, which was
Yeah.
about what is the dietary recommendations for kidney disease, the first thing is there's no one dietary prescription for all the stages of kidney disease.
Right.
And the diet actually changes as you progress through the stages from early kidney disease to kidney failure. But there are some commonalities. And so if I had to describe it to a person that doesn't know anything, I would say, if we're talking about food, everybody with kidney disease, whether you have slight damage or kidney failure, needs to have 2 serves of fruit, 5 serves of vegetables, adequate breads and cereals every day, so somewhere around 5, 6 serves. It's the dairy and it's the meat food groups that have to be modified. And we're modifying them for different reasons.
Right.
So when we've got early kidney disease through to around moderate, so this is when you've got about 50% kidney function, the purpose of the dietary prescription there is about helping control any comorbidities that you may have. So we're wanting to make sure your diabetes is well controlled, your hypertension, your obesity. And so what we would be encouraging is the recommended dietary intake of dairy, so 3 to 4 serves per day, and an appropriate portion size of meat, chicken, fish, or legumes. So it's essentially a healthy diet up until around stage 3-ish, 50% function. It's when you get to around 45, 50% function that there's things going on in the background with kidney disease that we need to start modifying.
Right.
So that's where we would recommend you really be conscious about your protein, because what that's driving is excessive phosphorus and making those little filters in the kidney work harder. And so we don't want to actually have excessive portion sizes of meat, chicken and fish and protein because of that. Yep.
So can I just check with you, because that's pretty complex for people, and they're going, oh, phosphorus. Oh, isn't that
Yep.
something to do with matches or something? Like, okay. So
Yep.
can you just explain, so what's phosphorus, and
Yep.
so what's the kidney doing with this phosphorus?
So phosphorus is a mineral that's normally filtered by the kidneys. It's really important for bone health, obviously. But when your kidneys are not working so well, behind the scenes, your body's working really hard to try and filter out any phosphorus that's not being taken up by bone.
Right.
Otherwise, it just sits around and hangs in the blood, and it's a real problem. And what
Right.
happens at this 50% kidney function stage is it starts triggering a real long cascade of mechanisms where, for example, the body goes, we've got too much phosphorus in the blood. That's
Right.
a problem. I think I might break down some of your bone to get some calcium so that we can combine the calcium and phosphorus together and form this complex so that it's not being too high in your blood and we can kind of get rid of it. It's
Right.
a way of controlling the side effects. But the problem is you're making your bone soft at the same time.
All right. So your body's that just shows, Kelly, doesn't it? Like how clever our metabolism is.
Yep.
Our body doesn't want any like toxic nutrients to build up. So it goes, got the solution for the high phosphorus.
Yep.
I'm going to go and bind it with calcium because that can stick it and take it out of trouble. And
Yeah.
your body can get rid of that, but it's taking it from your bone. So
It
yeah, your
does. It
body
does.
can't override that. So the excess
But
phosphorus is coming from the dairy and the meat.
well, yes, it will, because they're both sources of protein which have phosphorus in them. What I should also add is the reason that this is a problem is because that complex of calcium and phosphorus
Yeah.
together contributes to the development of a particular type of cardiovascular disease. So it's not like you're getting a blockage in the artery that can kind of be removed and scraped out. What it's doing is changing the structure of the blood vessel in a way that causes it to be damaged, but you can't really reverse it. And that's what
Right.
kills people with kidney disease. They often die of this cardiovascular disease before they ever reach kidney failure. And so
Right.
it's really important that we get that phosphorus under control and we don't have excessive portion sizes to kind of counteract that development of that in the background.
Wow,
Yeah.
that's really, really major. So, because, people will have heard about, eating saturated fat and how that lines your arteries and causes atherosclerosis. But this calcium phosphorus
Yeah.
complex is doing the same, but a different type of damage, and
Yep.
it's not affected by those other processes.
No,
Its own
no.
independent, super mean and nasty type of heart
It is.
disease
It's
by the
horrible.
sound.
Yeah.
Right. Okay. So more
Um,
reasons to just once you've got kidney disease to really, really prioritize looking after
yeah.
that.
Can I
Okay.
just explain what happens with once you've got, say, 50% kidney function or less? The
Yeah.
dietary prescription there is focused on, yes, we want to control your comorbidities, but we also want to control the side effects that are starting to happen. So the
Right.
phosphorus is one, but you will start to see people's potassium creeping up as you get to around 30% kidney function. And so the potassium being in the blood too high is a problem because it can affect your heart and it can cause cardiac arrest, and it's a danger. It's a life-threatening emergency. So the dietary prescription is then focused on making sure that we get adequate portions of every food group,
Yep.
including meat, dairy, protein, but not in excessive amounts because they all contribute to potassium. And what's changed in the last 5 years is that in the past we would have gone, oh, to control that potassium, let's avoid fruits and vegetables and only allow you to have certain
Yeah.
types. That's no longer the case. We are now
Wow.
focused on still eat 2 serves of fruit, 5 serves of veggies. That is going to do you more good than harm. What we want to focus on are a whole range of other sources of potassium that don't give you anything extra in terms of nutrition, but can be doing you damage. And that's where the excessive amount of dairy, the excessive amount of protein-rich foods will be doing the damage because it's also providing extra potassium.
Right.
But
So that's super interesting. So, certainly in the days when I graduated and when I worked in hospitals, it was still about,
yeah,
being careful about potassium from all sources. But just for absolute clarity for listeners, if they've
mm,
ever heard about people,
yeah.
soaking their vegetables to get the potassium out, that's out the window because
Not completely.
not
It's
completely.
there are a certain group of people who we may intervene with intensive strategies, but it's kind of like a fourth, fifth step down the line. There's a
Right.
lot of other things we might target first before we'd start doing those
Doing
kinds
that.
of things.
But what
Yeah,
you're saying is the frontline recommendation now is to eat those healthy foods,
yeah,
vegetables and fruit. You're
yeah.
not initially focused on potassium
No,
that may be in them. So people can
no,
eat their veggies and fruit, but it's the
please do.
potassium that comes along with protein source foods, including the dairy, that that
And
that you might put
additives.
limit on. Yeah,
Yeah.
and additives as
So a lot
well.
of potassium additives come from packaged foods now, and we want to focus on those. And I guess the thing that's really changed in the last 5 years is our understanding of the increase in additives in the food supply that are based on potassium and phosphorus has changed.
Yep.
But we also now understand that they're much more bioavailable, which means they have a much more potent impact on your blood levels than anything that comes from plant foods, because the potassium and phosphorus that's found in plant foods is actually really beautifully encased in the cell wall. And so it's actually not that available to be used by the body. You need to do a lot of things to make it freely available, whereas the additives in foods, they're just absorbed easily. Yeah,
That kind of makes sense. So people might have heard words like the food matrix. So it's kind
correct.
of like trapping in the plants. The
Yep,
potassium's trapped in the matrix, whereas you just add a spoonful of potassium, something or other, as a food additive, it can get
yep,
out of that food and into your blood much more easily. So there's some
absolutely.
of that was the key sort of advice that I'd
Yep.
heard had changed, but that's why I wanted to come to you
Yeah,
specifically to find out about
yeah,
it. But again, Kelly, like you can what our conversation's highlighting to me is how much people with kidney disease need that regular review
yes,
compared to
yep,
some conditions where you might go and see your
yep,
dietitian and your doctor a couple of times. This sounds to me like it's really
yep,
having regular ongoing care to monitor your
absolutely.
health over time.
Yep. And especially if you get to the point where you may be approaching dialysis, we need to kind of give you some warning that your diet now that you have to follow when you've got 20% function is going to be different from the diet that you follow if you had a transplant or if you had dialysis. And even the type of dialysis will dictate it slightly different, the dietary prescription. So it is a lifelong relationship where we do have to tweak that advice as things change because the side effects change, the effect of the
Yeah.
treatment changes.
Yeah. But what I think is positive is all of these things can affect the rate of progression of your kidney disease and
Yep.
certainly going to make you feel better if you're now, you know, anyone who hasn't heard that the liberalization of the veggie and fruit intake. But before we
Yep.
go on, there was one thing you said earlier, and I want to come back to because when you said it, I thought, oh, I hope everybody knows what you're talking about. You said that there are new medications that pretty
Yep.
much everybody needs to be on because it is addressing and improving kidney function. Can you
Yep.
tell us what those ones are? Because, you know,
Yep.
again, I think if someone's listening and you know someone in your family has got chronic kidney disease, I reckon it's worth having a conversation about those medications just so
Yes,
that people are
absolutely.
aware there's all this new information. So
Yeah,
what are
for
they
sure.
called?
So it's mainly, well, the benefits are for everybody with kidney disease, but they're specifically important and critical for people with diabetic kidney disease. And so there's 4 pillars.
Yeah.
And the evidence literally depends on the week you read the article. It's now 4 or 5 pillars in terms of medication management. And what they're saying is you need to be on an ACE inhibitor. So that's a drug like captopril, something like that.
Right.
Or an angiotensin receptor blocker. So this is a drug that ends with the name sartan. And these have a specific effect on helping control protein loss in the urine.
Right.
So they're 2 drugs. Then we've got this new group, which are the SGLT2 inhibitors. And these are the drugs that really help stop that glucose damage that can happen not just to people with diabetic kidney disease, but especially to people with diabetic kidney disease. So these are the drugs that are the flozins. And if you talk to a GP and say that SGLT2, they'll know what you're talking about.
Right.
And then there's another class of drugs, which is basically Ozempic. So these are the GLP-1 drugs.
GLP-1s. Yep.
But there's actually evidence that the GLP-1 GIP drugs, so the tirzepatides or the Mounjaros, are actually even more beneficial. So people should be using them not just for their weight loss, but for their effect on the kidneys and
On
the
the kidneys.
retardation of the kidney disease. Yeah.
Can I just ask you, because again, I reckon if people listen, they're going, oh, I'm going to have to replay that. That's so many words
Yeah.
they're saying all at once. Is
Yeah.
there like a fact sheet or an information site, a resource that we could put in the show notes and people
Sure.
go, don't
Yep.
worry, we're going to put a
Yeah.
link in the show notes
Yeah.
and
Yeah.
that will allow people to go and have a conversation with their GP about all of this
Yep.
information?
Yep. I can do. And there's even a beautiful picture as well that you can have a look at that shows what these drugs are and how they're the pillars. But the beautiful thing for me as a dietitian is that lifestyle advice underpins all of these
All of it.
things. And so you need lifestyle advice and these drugs to get the maximum benefit for your kidney disease. And for me, every conference I go to, there's some new benefit associated with these medications that tells me we won't have the same number of people going to kidney failure in the near future because they're just so effective.
Well, that's really important then to make sure.
Yeah.
So we'll definitely put a link in the show notes to that resource
Yeah.
for patients or that they can take to their GP to have a discussion. Now, there was another question
Yeah.
I wanted to ask you, but I think you've kind of answered it because the other new bit of information that I heard was that, you know, for kidney disease now, there's a real focus on plant-based diets, but I think you've already kind of explained that. But yeah, that's
Correct.
super interesting. I know. And it's not because it's just the latest trendy buzz thing, but from what you've explained,
No.
this is actually helping with actual progression of kidney disease.
Yeah, it's an interesting thing. There's benefits above and beyond what I mentioned too. So plant-based diets have a different form of potassium and phosphorus in them. So it's less bioavailable, but that's not the only benefit. What they also do is that they also help manage your acid-base problems that come with kidney failure in a way that's more effective than drug treatments. And that's amazing. So we don't want people to be having more medications, especially if the treatment is eat more fruits and vegetables. And we've done a clinical trial where we've demonstrated that we could achieve that kind of benefit just by giving them advice to have 30 different plant foods a week. As simple as that.
That sounds like something
We
to
then
target.
have
That sounds like a practical thing to target. I've got to
Yes.
tell you, Kelly, if people are unsure of that,
Yeah.
they can come on No Money, No Time and take the healthy eating quiz because it counts the number of vegetables and fruit variety. So you could actually get
There you
some
go.
indication of your baseline. But you
Yeah.
said another big
Yeah.
word there. So, and again, like acid-base balance, like what does that do? Where does that pop up out of the blue in terms of
Yeah.
something that you got to know about? Do people have to know about acid-base balance?
Yeah, they do when you've got kidney failure. So what happens normally is your kidneys filter out and help control the amount of acid that's in your blood. And
Yeah.
when they don't work, that mechanism goes wrong. And that's a problem for a couple of reasons. One is that when you have too much acid in your blood, it can basically cause the breakdown of muscle and contribute to the development of malnutrition, but also importantly, contribute to the hastening of the disease. So you actually have faster progression if you have poorer control of your acid-base balance. Now, the sad part in some ways is that until now, the treatment was actually giving a capsule of sodium bicarbonate. So you're getting the bicarbonate, which is the thing that reverses the acid problem. But
Yeah.
we're also loading them up with sodium. But the key message is we want people who have kidney disease to eat less sodium. So you're kind of
Ah,
giving contradictory advice by doing this.
yeah. And now
But
you've
there's
got a
been a
much
number of
better way to treat it.
Yes, that's right. Exactly. So that acid base problem is now being able to be treated in a different way, but there's additional benefits. And one of those other benefits is by improving your fruits and vegetable and your plant food intake, you also get more fiber. And we know that having more fiber helps with the balance of the bugs in your gut because there's an imbalance of those when you have advanced kidney disease for a range of different reasons. So we know that that actually contributes to better gut health. However
Yeah.
you might like to define that. Yeah.
Yeah. And can I just ask you another question, just back on that acid-base balance? Now,
Mm.
that must show how super, super sensitive our bodies are because if your acid-base balance gets out of whack, doesn't it? I thought you just died, basically. So is this really
Well,
micro, like your body is so sensitive that it's detecting these small changes in your acid-base balances that need to be corrected?
in you or I, if we got to those levels, it would be a problem. But people with kidney disease can develop, if you like, a bit of a tolerance to increasing levels of acidity.
All
And
right.
it's the same with their potassium level. They can adapt to chronic high blood potassium levels. And I've seen people with potassium levels that are very, very, very high that in you or I, who don't have kidney disease, would be fatal. And it's just amazing to think that your body can adapt to this. But eventually there comes a point where you would drop dead.
Yeah, it's
It's
kind of
amazing.
amazing though, isn't it? It shows how much
Mm,
our body is on our side and how
yeah.
all of these strategies and getting the right advice can look kind of like, oh, I don't know if it's the right word, but it's kind of like helping yourself be your own best friend or getting the most out of your body in many ways.
Yeah.
So,
Yeah.
are there any other key things that you think that people need to know about when it comes to nutrition
Yeah.
and chronic kidney disease? Because I think some people are probably going to say, "I think I'm going to have to listen to this again because there's just so much new
Yeah.
information in."
Look, I think there's a couple of things. I want people to be aware that the way that the dietary advice is being discussed has changed from a nutrient focus to
Yeah.
more about a food focus now. It's about your dietary pattern. Your pattern is far more important than if you had, a little bit too much of a certain type of, element. That's not the focus any longer. What we
Right.
know is that people who have certain dietary patterns have better outcomes with their health. And those dietary patterns are the ones that are higher in fruits and vegetables, breads and cereals, legumes, nuts, and those sorts of things. So aiming to have a healthy dietary pattern benefits everybody with kidney disease. But there is a really emerging challenge for people with kidney disease that we are not quite really able to face properly in Australia and New Zealand and across the world. And that's the problem. It's a double-edged sword. So there's been some really important studies done where they've shown that people who consume potassium chloride
Yeah.
instead of sodium chloride or normal regular table salt do have a reduced risk of stroke and cardiovascular disease. And so there's been this push to replace salt in packaged foods with a different type of salt, potassium chloride.
Right.
And The double-edged sword part comes with, if you've got early CKD, so up to about 50% kidney function, 50% kidney function or more, so you're doing quite well.
Pretty good, yeah.
You can tolerate that. It's actually beneficial and will bring you health benefits. The problem is if you have impaired kidney function, you cannot tolerate the additional potassium from that source.
Oh,
In fact,
dear.
it could be fatal. It's a real problem. And in
Wow.
Australia and New Zealand, we don't have potassium on food labels apart from as an ingredient. So you
Wow.
can't make a well-informed food choice about this. And manufacturers are doing the right thing. Like, for example, I've seen plenty of packaged foods that are labelled as reduced salt, and the way that they're doing that is by adding potassium chloride.
Right.
But our consumers with CKD, with kidney disease, are actually not quite aware of the fact that to achieve that, you're eating potassium chloride. And you
Yeah,
need to
that's a
know if
big
that's a
problem.
problem.
Yeah.
It's really challenging. Yeah.
So for people with 50% function or less, does that
Yeah.
mean you need to look at some of the key food groups to see if there's potassium chloride
Yeah.
added and then avoid that?
Yeah. I would at this point, because not only is it potentially highly bioavailable, we really don't know how much is in the food. And that's the
Right.
other problem. We can't
Yeah.
quantify it because it's not on the food label, as in the nutrition information panel.
Well, it
So
sounds
that's a
like there's
problem.
a few things we need to go into bat for on behalf of the
Yeah,
consumers to have potassium
absolutely. Yeah,
identified and clearer identification of when that's actually been added to food. Doesn't that show
yeah,
you that, something that's good for someone can actually be terrible for someone
yeah,
else? Thanks you for
yeah.
all this amazing information. There's one more thing that you have to tell me about though, because
Ooh.
you've given us a recipe and we're going to put it on No Money, No Time website. So what's the recipe and what made you pick that one?
Oh, I love this. This is Aiden's Tuesday night chicken, and we make
Yeah,
this when he goes to soccer. Aiden is my son.
yeah,
And it's a recipe that he makes. He's 15 and he
yeah.
loves it because it's so easy and he can tweak the spices. So basically, it's chicken soaked in Greek yogurt with a range of Middle Eastern type spices. You just plop it in the oven, bake it till it's ready, and we have it with a range of different salad items and vegetables and rice. And it's
Plant
so
foods.
quick, it's so easy. Yes,
Oh,
exactly. And it's easy to prepare, even if you've got limited cooking skills. All you need is a hot oven, really. That's
that sounds
it.
like a super yum one and something that's actually
Yeah.
great for people, particularly in those early stages of chronic kidney disease
It
and where they're
is. It's low in salt as well.
trying to boost their plants. You can have heaps of different veggies with it. Well, thank you for your
Yeah,
time. That's just so
my
wonderful.
pleasure.
And I'll liaise with you to get those links so we can drop them in the show notes.
Yes.
So thank you, Dr. Kelly Lambert.
Thank you. Thanks, Claire.